Hi everyone, today we are going to talk about treatment options of acne. If you find any valuable tips in this video, please remember to like and subscribe to Medicine AZ by Dr. Lenard. And don't forget to watch until the end to discover all the treatment options for acne. Your support means a lot! Acne is a common skin condition where hair follicles get clogged with oil and dead skin cells. This leads to pimples, blackheads, and other skin blemishes. Who is affected? It mainly affects adolescents and young adults, typically starting between ages 7 and 12, and often improves by the time they reach their 30s. Factors influencing acne include diet, like milk and high glycemic foods, stress, insulin resistance, and body mass index. Androgens, often called male hormones, are present in both men and women and can trigger acne by increasing oil production in the skin. Cutibacterium acnes, a common skin bacteria, can also contribute to acne when it grows too much or causes inflammation. Acne signs include whiteheads, closed pores, blackheads, open pores, small red bumps, papules, pimples with pus, pustules, large painful lumps under the skin, nodules, and painful pus-filled lumps, cystic lesions. Pathogenesis of acne begins with androgen stimulation, which increases oil production in the skin. This excess oil leads to an imbalance in the skin's microbiome, known as microbiome dysbiosis. The body responds with an immune reaction involving both innate and cellular immunity, which contributes to the development of acne. Main mechanisms involve follicular hyperkeratinization, increased sebum production by sebaceous glands, Cutibacterium acnes, C. acnes, formerly Propionibacterium acnes, an anaerobic dipteroid that is a normal component of skin flora. Inflammation. Acne begins with the accumulation of sebum and keratin, forming a microcomedo. As it progresses, it turns into a closed comedo, also known as a whitehead, or an open comedo, known as a blackhead. The immune system responds to Cutibacterium acnes bacteria, leading to inflammation. This results in red papules and pustules. Eventually, the hair follicle may rupture, releasing bacteria and pro-inflammatory lipids, which worsen the inflammation. Acne treatment options include topical retinoids to unclog pores and oral isotretinoin for severe cases. Topical antimicrobials and oral antibiotics help reduce bacteria and inflammation. Oral hormonal therapies can also be effective for some individuals. Topical antimicrobials for acne include benzoyl peroxide, azelaic acid, and dapsone. Common topical antibiotics are clindamycin, erythromycin, and minocycline. Topical retinoids are effective for comedonal acne by normalizing follicular hyperkeratosis and preventing microcomedones. They also help with inflammatory acne through their anti-inflammatory effects. Common retinoids include tretinoin, adapalene, tazarotene, and trifarotene. Oral antibiotics treat inflammatory acne by stopping the growth of C. acnes in the skin's oil glands and reducing inflammation, especially with tetracyclines. Oral isotretinoin is a retinoid used for acne vulgaris. It's unique because it targets all 4 acne causes, reducing sebum, preventing clogged follicles, fighting C. acnes bacteria, and reducing inflammation. Oral hormonal therapies, like oral contraceptives and spironolactone, are used for female patients with moderate to severe acne. They reduce androgen effects on the skin's oil glands, helping postmenarchal females, those with high androgen levels, or those with persistent acne despite normal androgen levels. Mild acne features small, scattered lesions like comedones, papules, or pustules under 5 mm with no scarring. It involves limited skin areas, lacks nodules, and doesn't cover large areas of skin. For mild acne with comedonal lesions, use a topical retinoid. If it works, continue as maintenance. If not, treat as moderate to severe acne. For papulopustular lesions, use a topical retinoid plus benzoyl peroxide. If effective, continue the retinoid. If not, add topical clindamycin or dapsone. Moderate acne includes numerous comedones, inflamed papules, or pustules with large lesions over 5 mm. It affects multiple body areas and often leads to visible scarring. For moderate acne, combine topical and systemic therapies. If extensive nodular acne with scarring is present, use oral isotretinoin plus topical therapy. Without scarring and with only comedones, Options include OCP, spironolactone, or isotretinoin with topical therapy. If pustules are present, add oral antibiotics to the treatment. Topical retinoids include tretinoin, adapalene, and tazarotene, used once daily at bedtime, available as creams, gels, or lotions. Treferetine is a cream applied once daily in the evening. Isotretinoin gel is used once daily at bedtime or twice a day. Topical antimicrobials like benzoyl peroxide, clindamycin, and erythromycin are applied twice daily. Dapsone 5% is used once daily, while the 7.5% is used twice daily. Minocycline is applied once daily. Topical combination products include benzoyl peroxide with clindamycin or erythromycin, clindamycin with tretinoin, benzoyl peroxide with adapalene, and benzoyl peroxide with tretinoin. Oral antibiotics options: tetracycline, 500 mg twice daily; doxycycline, 50, 100 mg twice daily or 100 mg once daily; minocycline, 50 or 100 mg once or twice daily; erythromycin, 500 mg twice daily; trimethoprim sulfamethoxazole, 160 mg 800 mg once or twice daily. Hormonal agents include combination oral contraceptives once daily and spironolactone 50 to 100 mg per day in 1 or 2 divided doses.
Stay updated with the latest in medicine. Subscribe to our channel for comprehensive videos covering the latest updates in the field.